Good. Thank you for sending the message, though, so we knew. Thank you.
I may need a little help getting that to move through.
Absolutely. I'll advance the slides for you.
There we go.
Thank you. All right. Good afternoon. The first slide I just wanted to share with you is really just a bunch of statistics, and numbers can be kind of fascinating and kind of scary at the same time. And I think scary is kind of where we're trying to put the emphasis here. In that, the first one here states about 35 to 40% of just generally healthy persons over the age of 65 fall annually. And of course, when we're talking about people with Alzheimer's, we are talking about someone who's generally not as healthy as a result of the condition. So in those cases, the incident rates really have tripled. And so you can do the math there a little bit there, and you can see that that falls are really a serious issue, and should be taken seriously. In fact, the second line talks about the unintentional injuries as being one of the leading causes of death in older adults, partially due to some of the issues we see below. Osteoporosis certainly is one of the reasons, because of the fractures that can occur, and when you break a hip, perhaps at that point you become less mobile. And as we'll talk about a little bit more here, you can see that moving is so important to maintaining good health of not only just your muscles and tissue, but everything in your body. So movement is we want to keep everybody healthy and moving as much as possible. I would like to go ahead and advance to the next slide there, if I could. The three areas that I've been asked to kind of address briefly are the physical and chemical and environmental aspects of or risk factors involved with falls. And we've got a few highlights there, and if we can move to the next slide, I'll just kind of go into a little bit more detail there. The first being physical, which is one of the areas of my expertise, and that is dealing with strength and balance and flexibility of the human spine and body. It's so important, again, to maintain movement. And from a chiropractor standpoint, I'm making sure that every segment of the body is moving functionally, properly. If there's any kind of inefficiencies there, can alter perhaps maybe gait or ability to lift or even to step, which could be one of the reasons why someone may end up falling. The old adage of saying "use it or lose it" is very, very true. Again, if you're not using the muscles, then the muscles are going to waste away. And so again, as I mentioned before, movement is very, very important. It also does stimulate brain activity. And since we're dealing with a condition that does have problems with the brain tissue, the wasting away of the brain tissue, we certainly want to maintain movement in order to stimulate from a neurological standpoint, the brain, in order to keep it as healthy as we can. Some of the ways that you can do that certainly will be taking some proactive steps that Nancy's going to cover in great detail. Ways in which you can not only just create strength, but really one of the keys is maintaining good balance. And things like yoga are going to be really a great step towards maintaining good flexibility and balance of the body. Also, there are going to be those that certainly aren't able to just jump right into a yoga program. And so we certainly, again, want to encourage them to stay moving as much as possible. So assisted devices can be used, whether it's a crutch or a walker, anything to, again, keep the person moving in order to stimulate brain activity as well as muscular activity to prevent the muscle wasting. The next section there is chemical, and when we talk about the chemical, what I'm really looking at here is unfortunately, as time progresses, we do often find ourselves in need of pharmaceuticals, and if we look at the side effects many times of some of our pharmaceuticals that we have, it does create some imbalances, and which could lead to vertigo or perhaps a loss of balance or muscle weakness as a result of the side effects of those medicines. So it's important to be informed about the side effects as well as keep informed with your doctors and especially seeing multiple doctors and making sure that the medicines alone as well as combined will not have any particular harmful effect in that manner. If so, discuss what type of alternatives would be available to help try to limit those, since that is certainly a great concern. The third area is the environmental, and what I mean there is basically your home. And we look at the home, we want to kind of keep it simple here and just say we want to keep a nice clear path throughout the home. So anywhere that we have an opportunity to perhaps maybe trip up or create any kind of instability or balance, we want to make sure that is eliminated. Keeping up with maintenance, for instance, if you have carpet or flooring that may be lifting up, we want to make sure that those areas are well maintained, and again, reducing risk of any opportunities for catching foot and perhaps having a fall as a result. The last one there is additions, and the additions section there is really just kind of talking about any kind of things like for us in the shower, using a bar in order to have something to help give added support in case you start to slip or fall. You would have something to grab a hold on to help give again more and more support. And again, those are the kind of things that we want to have kind of ergonomic, would you say, throughout the home in order to help reduce any likelihood of any slips or falls. The only other thing I just want to quickly add is with regard to the falls. In the event that there are falls, it's always important to just really find out how the fall occurred and to make sure that the physical or the chemical or environmental cause what had occurred and what you can do to help prevent that from happening again. Of course, seeking attention, because many times the falls, while it may just look like a bruise on the outside, could have more devastating effects on the inside. Certainly not encouraging to cry wolf, but certainly being as cautious as possible. As well as one recommendation I have, especially with someone with Alzheimer's, is many times because of the memory issues, what we're looking at here is maybe having a journal in the event that they do fall, to try to encourage them to write down their falls and how it happened, and in that way, when you come across them and say, gosh, where'd that bruise come from? I don't know. Well, maybe we have a journal in which we might be able to help determine how that fall occurred and then take steps to prevent that from happening. At that point, I'll go ahead and move back to Ann for the next presenter.
It looks like this next slide, also, Kevin, you may want to talk about.
Okay. This is kind of getting into the household environment here, thinking about some of the areas where we could have some problems, and this is kind of going back to to making sure that the home is well maintained. Certain things like lighting. It's certainly harder to see those areas that are, the rug that are maybe elevated up a little bit or hanging up. The lighting is poor. Certainly making sure that you're wearing shoes that would be more supportive and not loose shoes that may have an opportunity to catch on something. I think we touched on a little bit on the pathways, making sure that the walkways throughout the home are always kept clear and open, because again, most of these injuries occur in the home, and again can become something that you wouldn't expect it to happen in locations that you wouldn't expect it to happen, just doing your normal day-to-day activities, not necessarily out in an unfamiliar area. The familiar areas are, again, typically where those occur.
I think this is an excellent tie-in between, some of the things that you had to share and the things that we would like our caregivers to speak about. Wouldn't you say this is a good time to move into that?
Yes.
So if we could hear a little bit from Jan or Bob or Mike, do you all have anything that you'd like to say that will kind of give personal examples of what Kevin has had to talk about in terms of falls in the home, either in terms of stairs or falling in the bathroom or possibly in the kitchen, and what we're looking at on the slide now? And remember, press 6 to unmute.
This is Bob.
Thank you, Bob.
Yeah, I thought I'd just comment very quickly. One of the things that I found was an increasing loss of balance that gets a little bit worse as the progression goes on, and that coupled with a failure to recognize obstacles or dangers or even common objects at a certain point. And I see that getting increasingly worse as the disease progresses.
I think that really ties in with some of the things that Kevin has said about, it's the normal day-to-day things that you may not even think about, and the importance of being mindful of common hazards that we may not be aware of. And I think that's going to have a lot to do with some of the things that Nancy is going to share with us in terms of balance, too. I mentioned at the beginning how important it is to look at this from multiple perspectives that maybe we don't think about on a regular basis, so I'm glad y'all are all here to share your knowledge and expertise. How about Jan and Mike? Do y'all have anything you'd like to add?
This is Jan.
Hi, Jan.
Well, we've been at every one of these places.
Mm-hmm. Sure.
And I love the phrase non-intentional injury. We had to take just a total look at the house or just life activity and just totally reshape everything. Instead of trying to get her to avoid things, cleared paths, but we also made paths that were soft because she was going to fall. Got hard edges away, and got rid of shoes that were loose or leather bottoms. Just everything. And certainly medicines were a big issue. And like you said, why did you fall? And we certainly did the journal. We started a new medicine, and we got a rash of new falls. It made it very clear to say you started Cinemat and were falling all over the place. So that really helped going to the doctor with that information.
That's an excellent point, Jan. Did somebody give you the advice of doing the journal, or did you come up with that, trial and error on your own?
I just think that was general information, and I certainly got to say that I had an advantage of taking the training with Senior Connections for home caretakers. That was excellent. Recommend it to anyone, and hope that it continues to repeat. We learned a lot of that information there.
Well, thank you for saying that. Since Judy is on the line, we certainly want everybody to know how great that training is. And that's one of the reasons we want to have these not only on a regular basis, but also archived so people can hear this information from caregivers in terms of what really worked for them, because that's where the expertise is, we think, of course. How about anybody else? Do you have anything that you'd like to share about falls in terms of what we're looking at here on the screen?
This is Bob again, if I could just add something.
Please.
Very important point on the journal. I found that to be a twofold thing, not only to help the doctor out and to help you out, but it also is kind of a stress reducer. I've journaled for about 15 years now, and I've just gone back to look at some of the journaling that I've done, and it's amazing what you find in that. And the second point is one that the doctor brought up about medications. That is, I think, is very often overlooked as a source of falls, and a little-known side effect of the 4 major medications that are being used now, the Aricept and such, they do cause fainting spells and falls, which took us an awful long time to find out. So I think that's something everybody should be made aware of.
I think you're absolutely right. You know, when they list off all those negative side effects, sometimes you don't always pay attention to what all of them might be, and that is certainly a big one. It's a huge risk factor, so you're absolutely right. And I'm glad, Bob, that you brought up that point about journaling as a stress reducer. For those of you who weren't around for the previous webinar, Bob was there to talk about communicating with your physician, and obviously Mike Costin was there to offer that in the newsletter, too, so that information is there for those of you who want to go back and look at that. I'll encourage you to do that. And in terms of journaling as a stress reducer, there's a lot of research currently going on about journaling as little as 3 times a week for 15 minutes at a time, reducing salivary cortisol levels. So it's not just that we think that it makes us feel better. There are physiological changes that occur in the body after journaling. So I'd encourage everybody to consider that either as a tool to communicate with your physician or to keep track of the events in your caregiving, and also as a stress reliever. I think that's a very important point. Anybody else have anything to share here?
Hi, this is Eileen from the Alzheimer's Association.
Hi, Eileen. Welcome.
Hi. I wanted to speak a little bit about the footwear issue on this slide and perhaps get some input from our chiropractic speaker, because I found that sometimes a shoe that is right for one surface is not right for another. For example, sneakers. Sometimes a person is in a sneaker-type shoe and it's doing very well on the carpet, but then they transition to, maybe they still have linoleum or some sort of a tile, soft tile, anything like that, wood. And in the transition, and it's not a question of a different height or their perception of a drop, which sometimes happens with dementia, but just the transition from one type of surface to another, hard, soft, can make the person fall, or the shoe kind of catch, if you know what I mean. And that's when even younger people sometimes have this happen. And I think it has to do with not picking up the foot completely off the ground, in making the step, but many people drag a little bit, and particularly people with Parkinson's and people who are on some medications that cause shuffling do tend to not lift their feet very high. So I wonder what we do about that when a shoe is right for one surface but not another.
That's a good question, and some of it does come to a little bit of the gait training in order to really develop a good gait. I know coming off of a carpet, many times you will kind of drag that foot around, and as it'll certainly grab on a harder surface a lot easier with a sneaker, which then could certainly create some skipping or skidding, I should say. And the types of shoes, if there's actually a better type of shoe, certainly you would want to try to avoid shoes that have very kind of blocked off ends or high soles. That would eliminate perhaps a little bit of the potential drag. So certainly having something with a little bit of lower front end on them, in a sense, and the sole would eliminate that potential drag there. But of course, a lot of it has to do again with more of the gait training, as well as really maybe emphasizing that and making it, it's again one of those things that we kind of take for granted, is going from one surface to another surface, and we know that we need to almost have to start to become a little bit more conscious of that, and perhaps maybe bringing it more conscious to our level as well, as saying. I remember moving from one level to one type of surface to another. We just need to maybe take a pause or a break and move and transition into that new type of flooring.
Okay. I think sometimes caregivers pick the very thick sole. They may pick a running shoe, even though the person is definitely not a runner, thinking the more padding the better because of, possible plantar fasciitis or, the aging of the foot and the loss of the foot pad. They need more cushioning for their spine and back. So I think a lot of people are thinking maximum cushioning, maximum sole, but you're saying too much sole, if there's a foot drag of any kind, could actually be more of a problem, if I understand you correctly?
Yes. The thicker the sole, certainly you have to lift your foot a little bit further. with the way the gait is, you usually have a little bit of external rotation of your foot as you're swinging it through, and the thicker the shoe, the more movement you really kind of need, and more space you need to swing that foot through. And if you have a tendency to drop the toe, perhaps that would also kind of catch. So again, using more of a shoe that has maybe a toe that kind of curls up a little bit more than being flat. And again, maybe going with something with just a thinner type of sole would be beneficial.
Great. Thank you so much.
Sure.
I think that's excellent advice, and it really goes back to what Jan, one of our caregivers, said, that you really have to think about the whole environment and, all of those pieces that you may not have thought about before. Think of them differently. Does anybody else have anything to share before we move on to Nancy?
This is Jan.
Hi, Jan.
I wanted to mention we took a look at the mirrors and reflective glass around the house because she would not recognize herself. It would startle her or encourage her, like in her normal bedroom mirror, she sticks in her hair or something. When she reached her arms up, she would lose her balance quite a lot there, and it just seemed like we started limiting the amount of mirrors that we had around.
Yeah, that seems like good advice, too, certainly. Back to what you said, but you really have to consider the entire environment. I think we all think about things like throw rugs, but you don't think about all of the, so many numerous things that are in the house. And it's so much better if we can all learn these from folks who have experienced it before us rather than having to learn it the hard way. Why don't we go ahead and move on to Nancy? I have to give a plug at this point because Nancy is one of our outstanding graduates of the Department of Gerontology. I didn't tell you all that, did I? That I was just plugging my own graduates. Well, she really is amazing in terms of what she's done in the community and spreading the words about the benefits of yoga. And so I'd like for her to go ahead and share with us a little bit about what she does.
Okay. Hello, Anne. Just to a little bit of history as far as when I'm looking at things, what I'm looking at, I was a family caregiver, not with someone with Alzheimer's disease, but with a son with a traumatic brain injury who had dementia, and also then as a caregiver for a mom who had polio, so a lot of issues with gait, and eventually in a wheelchair and confined to dad in the home, as well as dad in a nursing home. So that's what led me to the gerontology program, and what I've used using yoga and integrating in. So that's how it kind of all fits together, how I have the gerontology and I have a yoga and wellness center. But can I just mention something? And Kevin, I was noted when you were mentioning the toe drag and working with lifting the toes up. One of the things that I have seen in working in assisted livings and long-term environments, as well as older adults in the community, is often the support stockings and the pantyhose cause the toes to draw together and create less mobility with the toes and with the feet. And also the weakness in the legs of the muscles of the legs, particularly in the shins, really allow the toes to drop. And a lot of falls are caused because of that. So I also would like to add in before I get started with my presentation, before I forget this, one of the things I would suggest is even with the support hose, to get those with the toes out, open, so that, and I know here in Richmond, Westbury Pharmacy handles those and can order those, so that there is mobility with the toes and feeling the floor to help with balance.
That's absolutely correct.
That is terrific.
It's very important to have that movement with the toes. It's all part of the walk.
Right.
And so
right.
You're absolutely correct, and thank you for adding.
Yeah, so I just wanted to add that in because I see that really often, even in, I go to assisted livings and long-term care and skilled nursing areas and do seated yoga. with folks, and even in those environments, the ladies are still wearing their pumps and they're still wearing their pantyhose. So that's kind of something that causes a lot of issue. And again, Kevin, I think you just covered so much exactly the slide that I have up now as far as the statistics. We all know about falls, and we all know that falls are a leading cause of injury and death among older adults, and we all know the fractures and the issues with osteoporosis, with frail bones. And we've talked some about the factors contributing to falls, but I just wanted to review those briefly. History of a previous fall and fear of falling. When I mention fear of falling here, most older adults are concerned about falls. They're concerned. So what they do is they spend a lot of their time looking down at the floor with forward head carriage, which then increases their number of falls because they're not looking out in front of them. And so if you couple that with the curvature in the upper back, what we used to call dowager's hump, or kyphosis, that roundedness that often is the case as with older adults, and looking down at their feet, then we're going to have more tendency to falls, whether with or without a walker. Obviously, with a walker, if the walker is not adjusted properly, then you've got a lot more forward head carriage. But what we try to do really often is work with people to have their head level and their eyes looking out a ways out in front of them in front. Another factor contributing to falls is dizziness. Obviously, we've already talked about that in the medications, and the issue with medications that people are taking. A problem with gait imbalance, a lot of that is when we're talking about strength in the muscles of the legs. Oops, I didn't know that was increasing. I have no little arrows here, but I'm pretending I do. Okay, they came up. I think I'm back. Okay. So with balance, one of the major issues is we work with strengthening the muscles in the feet and legs, working with strengthening the muscles that support the spine, the paraspinal muscles, and working on mobility of the toes and the feet. So increase in flexibility of the ankles, increase in strength of the legs, the quadriceps are important to help with those balance issues, and we'll talk more about that. Neurological, musculoskeletal disabilities, confusion, disorientation. I use yoga to help to focus on the breath. And in working with folks in early stage of Alzheimer's, with dementia, focusing on the breath and working with muscle memory is calming for the nervous system, helps to bring the thoughts back into the body, and end up decreasing the and helps to decrease the disorientation that people otherwise will feel. We've talked about side effects of medication use and visual impairment. The Mayo Clinic had actually issued this, that individuals with Alzheimer's disease who participate in moderate exercise feel better physically, feel better emotionally, have decreased risk of falls. Wandering becomes less. I was the director of an adult day center for a few years, and we found with our Alzheimer's, the folks that were in our Alzheimer's unit, that when we had physical activity going on, a seated yoga is really what it was, and some shoulder and neck massage, that we had less issues with sundowning in the afternoon. And then delayed nursing home placement, obviously, the more physically able people can move about safely, that is what everyone's looking for. Yoga softens the aging process by moving every joint in the body through a full range of motion, but doing it gently. And I do believe, and I want to just stop here because I did hear earlier that some folks really can't practice yoga, and really everyone can practice yoga. Right now, the oldest student taking our classes is 102, just getting ready to turn 103. So with seated yoga, you can actually break down the yoga asanas to their essence, to their bare essence, and everyone can practice. Don't need to be able to get up and down from the floor, and don't need to be able to move into any of the positions that you see in books and videotapes these days with 20-year-olds practicing. But it can be used to increase the flexibility of the spine, to lengthen the muscles, to strengthen the body, to increase the balance. And balance can be increased while even sitting in a chair, not even from standing. So in working with folks who are in wheelchairs, I did that with my mom, you can increase balance. And deepening breathing, obviously when the breath is more complete, the strength is going to be more complete, and the focus, more of a calm nervous system when the breath is more complete. So when we're looking at yoga and we're looking at preventing falls, the balance, coordination, the posture, being aware of the body, where the body is in space, which is an issue with dementia, and working with body mechanics to think about things like the kyphosis and minimizing that curvature in the upper back, and being aware of when the knees are locked because the quadriceps, the front of the thighs, are so weak that the knees are locked, then throwing the entire gait off, the body off in the movements. Being able, one of the things, being able to get up and down from a chair, to transfer to and from a chair as well as to and from the floor. Obviously, a lot of falls occur there, not just in walking. And the getting up and down from a chair, getting up and down from the floor is something that yoga really can teach us, and that's what we did in the study that I just completed. And I'll talk more in a second. Any questions so far? Everyone's so quiet. Is anyone out there?
We're all here.
Okay, just checking. Okay. I'm an extrovert. I can't stand this. Okay. When falls happen, yoga reduces the degree of trauma and the likelihood of fractures by strengthening the body and increasing flexibility, and we'll talk about that in just a second. In 2000, I was going to an assisted living and still going there. I'm glad to say, an assisted living here in Richmond, Virginia, and doing seated yoga. And what we did was a small study with the Department of Gerontology and helping us out, getting us a gerontology student to help us there. What we did find was over a 6-month period, those participants in our study increased their feelings of general well-being, increased their knowledge of body awareness, knowing where their body was, whether they were sitting in a chair or standing, and their body carried. So we worked a lot on use of walkers, use of canes, transferring in and out of a chair or wheelchair. Those participants also, the number of falls were decreased, and we used those and compared to the other similar in age and disease state residents in that assisted living. We used those folks as a control group. And the group of folks who were in our study decreased their number of falls and the resulting injuries caused by the falls. And the assisted living center actually maintained and kept up with those for us. And now we have just completed what was a 6-month study, and we are still tabulating the results. purpose of the study was to determine the effects of therapeutic yoga on older adults living in the community by increasing their ability to comfortably transfer to and from the floor. And my premise was that if we could increase the flexibility of the ankles, increase the strength of the quadriceps, the thighs that protect the knees, increase the balance, and show a protocol for transferring to and from the floor. And these were 50 participants started with us, and 45 of those 50 finished the study. What we wanted to do is to show them a protocol to use to transfer to and from the floor. And the participants took a therapeutic yoga class for 3 months, once a week, and they followed a DVD, which I prepared for them to take home 5 days a week. So what we had was good compliance with the participants practicing 6 days out of the week, which is obviously the key to do something. The video is only a half an hour, and I did design that so that is available now for folks to purchase. But it's a half an hour, it's brief, but it works with the protocol that we followed in that study. Mm-hmm. And we found that after doing that, and what I had was a physical therapist actually doing the measurements of each of those studies. They used the bird balance scale, and the physical therapist measured also using a dynamometer, the quadriceps strength, and a dynamometer, the ankle flexibility. We did find with every one of the 45 participants that they were able to transfer to and from the floor more comfortably. Some of them, one had 2 traumatic brain injuries, came in using a walker, and in 3 months is only using a cane now on occasion. But statistically, all of their measurements improved. And we had some individuals that for 5 to 10 years hadn't gotten up and down from the floor, and were within a course of an hour class getting up and down 4 to 6 times. So I'm really encouraged, very pleased, and then what we plan to do is to publish the study. These classes that worked with the study, the same protocol is being used in our ageless yoga classes now at our center. And then what we're doing, I go to assisted livings and to long-term care environments, try to get in as often as I can to their dementia units. But I don't find very good compliance with the assisted living staff in bringing the folks who are in their memory units into classes, although they benefit greatly, because the repetition of movement of yoga, I believe, increases muscle memory. And the earlier in the disease state, particularly with Alzheimer's disease, that you can begin repetition of movement, the more the muscle memory will be there. And it results in calming the nervous system, which increases the focus, the individual's focus and attention to the moment, and the attention drawing more inward, which is what you're wanting to see. So thank you.
That's an excellent point, Nancy. I hadn't thought about that in terms of muscle memory. But did you also say that you had difficulty with the staff bringing the participants?
Yes.
And do you think that was because they thought that it was less useful, or because of just their unfamiliarity, or what? Do you have any thoughts about that?
Well, I don't think, because the environments where I've been going for years. And 9 years to one location and 6 to another. I think there is, in general, and I'm speaking as a nursing home administrator who doesn't use her license, but I think there is a misperception among the direct caregivers in the long-term care environment that individuals with dementia due to Alzheimer's or traumatic brain injury or multi-infarct dementia because of strokes, I think there is a misperception that it doesn't really make a difference.
I see. Well, and, we spoke in our last webinar about the importance of advocacy, and I do think that this is another opportunity to advocate for exercise for all people. In this case, obviously, we're speaking about people with cognitive impairment, but certainly in late life exercise, in this case, yoga can help everybody. So I hope that we'll all take that as an opportunity to advocate for our loved ones again.
And that muscle memory that I was talking about, we do have a couple of students who are still independent in the community who do come to our yoga classes here, our ageless yoga classes, because that is what they are trying to establish, that muscle memory.
Well, that's a very important point, I think. I see you have another slide that has comments for study participants, but we do just have minutes left. I want people to be able to ask you questions if they have questions. So do you mind if we, people can see those comments, and I'm sorry we don't have a chance to talk about the fellow who came and said he was just looking for a girlfriend. But I want to see if other people have questions.
But if anyone knows of anyone, he's 84 and he's charming. He has increased his ability to get up and down from the floor. He's quite charming, and he is still looking for a wife. He doesn't want a girlfriend.
Oh, not a girlfriend, sorry.
He wants a wife, yes.
Okay. Does anybody else have questions or comments, things they'd like to ask Nancy or any of our panelists, actually?
Just as a reminder, if you have muted your telephones, remember to either press 6 or unmute your phones.
Nancy, I'm very interested. It's Annette Clark. I'm very interested in doing a yoga class here in the Roanoke, Virginia area, and I was considering combining caregivers and individuals who have been diagnosed with dementia together in a group. Is that a not-so-good idea? Is it better to separate them? And do I need to find someone who's very tuned into dementia in order to be the instructor for that class?
I think combining the two would be a terrific thing, but I find often that the individuals who have dementia focus more effectively without the caregivers there fussing over them. So, and as far as so I think that they would be fine together as long as the attention is kept by the caregiver. I do train the trainer with locations so that then people can go ahead and carry on and teach after as well. So I am willing to go and do a train the trainer to be able to, if there isn't someone locally who has that knowledge, or to set up that type of a program. If you're looking for a yoga instructor in any area, the best place to find someone who is qualified is to look at a website. It's yogaalliance.org. No spaces, just yogaalliance.org. They are the national certifying organization, and they will help to find someone. You want someone who has a 500-hour training program certificate, and you will see it's broken down by city and state.
Okay.
And then it would be finding someone who teaches gentle restorative classes and who works particularly more therapeutically with older adults. So that would be, if you're trying to locate someone, that would be a best place to go.
Okay. All right.
Okay.
If someone is interested in going through your Train the Trainer program, can you send us out information about that, or?
I don't really have anything written about that quite yet. I have a lot on our ageless yoga and a lot of brochures in general, but I'd be willing to be more than happy to talk with anyone over the telephone to talk about trying to arrange something like that.
Okay.
Okay.
We'll make sure that everybody has contact information for Nancy. If you go up to if you highlight a person's name in the list of participants, you can see their email addresses. But we'll make sure that you have that information so you can contact each other. Okay?
Great.
Other questions? Okay. Well, I thank you all for participating today. This has been really very informative for me, and I hope for you all as well. And I want to thank our excellent panelists. Again, each time, I think Nico does a terrific job of bringing the right people together and producing this in a way that I think is accessible to everybody. So thank you all for participating. Thank you to our panelists. I hope that you'll all be available to participate next month. Next month our topic is going to be about skin care. And actually one of our panelists, Judy Nelson, is on our discussion today. So she'll be one of our participants for next time to talk about skin care in older adults, particularly with dementia. And you'll be all receiving information about that one. And this will be archived. So if you'd like to share it with other people that you know, please do that, and please do spread the word. Nico, do you have anything that you'd like to say?
No, just thank you very much to all, and apologies for my disappearance at the beginning.
Anne?
Yes.
Or Nico, I do have one thing to say. It's Judy Nelson.
Yes.
Yes, hi, Judy.
Hey, hi. If anybody had any particular questions in this group on skin care or, it'd be great if they could email them.
That would be wonderful.
Will do.
And we could kind of get a jump on questions.
And since you all got an email from Nico setting this up in terms of your registration, if you could send any questions to her and she can funnel them to Judy, how would that be?
Terrific.
That would be great.
How's that, Nico? Okay for you?
Will do, absolutely.
I know, I'm just volunteering her, right?
Yeah. Yeah, that's fine. Or they can send them to me if they'd like at Nelson at youraaa.org. Either way. And then we'll see if we can get those answered ahead of time.
Okay. Well, thank you all again. Thank you, panelists, for your hard work in putting this together. I think this has been very helpful. And again, the key to advocating for our own better care and the better care of our loved ones is through this type of education, so please spread the word.
Thank you very much.